So, do vestibular issues ever go away or resolve? I got that question recently in the community and thought that is a great idea for a video. So let's jump right into it. This is a 3-part answer. It definitely depends. So first, if your vestibular issue was caused from a central vertigo issue, so that might be something like a stroke, a tumor, something of the brain like a neurologic disorder like MS, or Parkinson's, something like that, where it's a central vertigo issue, it's going to take longer, and it really depends on the condition that you have as to whether you're going to see a complete resolution of your symptoms or if it's just going to take a lot longer and you might be able to manage your symptoms. So you do need a healthy brain to compensate for that vestibular issue, that miscommunication between the ear and the brain. So if you have central vertigo, it's a maybe. Definitely worthwhile to go to vestibular therapy, but it will be a harder road. The second would be if it's a peripheral issue, so from the inner ear. So if you have had a neuronitis, something that's attacking that vestibular nerve, neuronitis, labyrinthitis, maybe a concussion of the labyrinthine there, it's definitely possible for you to have all of your symptoms go away, as long as you have a healthy brain and as long as you are taking your vestibular therapy and progressing it appropriately to your functional capability or limitations, really. So some errors that I see is patients do their vestibular therapy for neuronitis, but it's always in seated or maybe in standing, but they never advance to like a foam pad or walking, for example. So it's completely possible to heal from a neuronitis if you progress your exercises appropriately enough and if you have a healthy brain to do so. And then the last part of my answer would be is, do you have an evolving condition? So that might be something like vestibular migraines, Meniere's disease, endolymphatic hydrops. So it's something that is episodic and evolving. It's not a stable condition. So when we do look at treating vestibular therapy patients or with vestibular therapy, we look at central, is it the brain? Is it peripheral, the inner ear? Or is it a condition that is episodic and giving you spells? So with Meniere's and hydrops, that's more about the plumbing of the inner ear, and that is going to be less effective with vestibular therapy and more effective with medication management. So that's something that you're going to talk to your doctor about. Are diuretics appropriate, beta histines, cortisone injections, prednisone during flare-up? So something like that that's evolving. Vestibular therapy can help educate you, can help you with recommendations for dietary education, and then also maybe be your advocate on what works best with medication, or just teach you what to communicate with your doctor. But therapy exercises aren't going to prevent endolymphatic hydrops or Meniere's. We just might be able to do exercises to keep you more stable after an attack occurs. And then the other condition that I mentioned is vestibular migraine. Now that is something that you're going to take a multifaceted approach to treatment, that you have to have a good neurologist, medication, supplements, a good vestibular therapist that can, again, identify your triggers and help desensitize, help increase your threshold to your triggers so you don't get so many frequent migraine attacks. So vestibular therapy can definitely be effective for migraines. Again, it's more education and then trying to increase your threshold so you don't get a migraine, and then educating you as to how to prevent them in the first place. So to my friend who asked the question, do vestibular issues ever go away? My complicated answer is it depends. It depends on your diagnosis. It depends on where your symptoms are originating from. And then if you have a proper diagnosis, we know which exercise plan and treatment should be appropriate. And then that can help lead to either a full resolution of symptoms or just an ability to manage those symptoms and attacks. So hopefully you find that helpful. If you have any questions, leave them in the comments below. And until I see you next week, stay healthy, stay steady, and stay strong.